With Burt Barron on the new Talk Radio 1450 WCTC, the voice of Central Jersey. From politics to entertainment, from social issues to lifestyles, from newsmakers to pop culture. If it's Jersey, it's on Jersey Central with Burt Barron, 732-545-9282. Or toll free at 888-545-9282.
7:37, we're back on Jersey Central, Tuesday morning on the new Talk Radio WCTC, the voice of Central Jersey. Contest is on the way. Chance to win the tickets to Throwback Bash and the brand new Bon Jovi CD called Burning Bridges. Both prizes up for grabs later on today. Stick around, hang around. Maybe you're going to be the lucky winner today. Well, it is September and is also Prostate Cancer Awareness Month. And joining me now to talk about some things that we need to know, he's a leading radiation oncologist with ProCure Proton Therapy Center, located in Somerset, New Jersey, serving patients throughout New Jersey, around the country, and also attracting patients overseas, which I think is pretty cool. Let's welcome back Dr. Henry Tsai to Jersey Central and WCTC this morning. Dr. Tsai, welcome back. How are you, sir?
I'm doing well. Good morning. Thanks for having me.
Good to talk to you. Thank you. Let's take a few moments to talk about the treatment options. You know, once someone receives that diagnosis, it's probably maybe a little bit of, I'm sure it's a pretty scary time for someone who receives a cancer diagnosis. So I guess the first thing you want to do is talk about the existing treatment options that are available. And the best thing to do is talk to somebody at ProCure about how proton therapy can help them, right?
Absolutely. Once somebody's been diagnosed prostate cancer, a big component of what has to happen is they need to decide and find out what options are available to them. And proton therapy certainly is a very good option for prostate cancer patients. Proton therapy is a very unique type of radiation treatment that really targets the prostate and minimizes the radiation delivered to the normal tissues around that prostate.
And it seems like that's just one of the many advantages that we've talked about, of course, on this program before, is that it's very focused and there's no damage done to the surrounding organs. Which is it pinpoint accuracy, Dr. Tsai? Is that fair to say?
Yes, the proton beam has the ability to stop within the body as opposed to passing all the way through like an X-ray beam would do. So when proton beams are delivered to the patient, we're able to more accurately target the prostate, and pinpoint accuracy is our intention here, and to minimize dose to the tissues that are right behind the prostate, which don't need the radiation.
Talk more, if you could, about the science behind this use here. How does it know when to stop? How does it know how far it's gone and says, okay, I'm not going to go any further than this?
Well, the physics of proton delivery have been studied for decades, and we know very precisely at what energy level is needed to have a beam get to a certain distance and stop. So we're not leaving it up to the proton beam to decide. We decide up front, depending on the patient's anatomy and the specifics of a patient's situation, we can decide how much energy to give that beam and therefore stop the beam when we need to.
Talk about side effects and the recovery process, Dr. Tsai, and the benefits of proton therapy as it relates to that.
Sure. So proton therapy is a very gentle and non-invasive treatment option. It doesn't require surgery. It does require several visits to our center to receive the proton treatments. But once a patient is in position and lined up to the beam is delivered to the prostate, and after a few minutes, the proton exposure happens, and the patient comes off the table and goes on the rest of their normal day. The side effects typically are very mild, maybe a little bit of fatigue or urinary irritation, but for the most part, our patients get through treatments and have a very pleasant experience.
Is it multiple treatments, Dr. Tsai? It's just kind of a one-day kind of thing, or is it over a period of time?
Typically for prostate cancer, our typical regimen now is daily treatments, only 5 days a week, Monday through Friday, and typically a course of about 44 treatments is the target.
And you hear oftentimes about a lot of the side effects of maybe someone who's undergoing traditional chemotherapy. I mean, the nauseous feeling and the hair loss and all that. Does any of that come with the proton therapies?
No, proton therapy is a very direct treatment, and really the more systemic side effects of chemotherapy, like nausea and vomiting and generalized fatigue, don't apply to proton therapy. Most of the effects are really just limited to the prostate area.
Very amazing. And we've had people come by here in the past, Dr. Tsai, patients who you have treated, and you and your fellow experts there at ProCure have come to this radio station. They've talked about how it's saved their lives and it's changed their lives. And we've heard from so many people who have come by the station over the years to tell us about that. Have you stopped counting how many people you've helped, Dr. Tsai? It's probably got to be in the hundreds, if not thousands, since you've been open in Somerset.
That's right. I mean, we've had many patients in the hundreds come through with proton therapy, and proton therapy is even evolving, and we've kept up with the evolution of proton therapy. We now offer our prostate patients something called pencil beam scanning, which allows us to even better shape the proton beam distribution.
Pencil beam. So it's almost like you're it's almost like a Photoshop kind of thing. And just to give it kind of a real world kind of example, it's kind of that precise and that accurate.
Well, it enables us to use almost like a spray can technique where we have a prostate volume and we paint in the dose with a sub-centimeter sized spot of proton particles, and we can then basically fill in that volume and more accurately shape the proton beam distribution.
That's incredible. 20 or 30 years ago, Dr. Tsai, I'm sure people were saying this technology will never exist. It's like Star Trek kind of stuff, but it exists. It's here right now for people.
Right. It sounds amazing, but this technology has been around for decades, and we have brought it to this area and made it available to patients in this area. And with Prostate Cancer Awareness Month, I think it's more and more important that people learn what their options are.
Yeah, I agree. And thank you so much for mentioning again about the Prostate Cancer Awareness Month here in September. What's the first step? Does someone maybe just go for a routine checkup, and that's part of the procedure? And then if they see something kind of going on in there, they'll have them come to see you. Is that the next step?
Yeah, typically, I think the first step is to, essentially go through a screening process with the family doctor, see whether they're an appropriate candidate for what's called PSA screening to detect prostate cancer early enough to treat, and decide if that's the right thing to do. And then ultimately, a biopsy would be necessary to prove the evidence of prostate cancer, and then, potentially seek out one of us to discuss potential treatment options.
Talk about, is there an age threshold where this needs to be more of a concern?
Well, the age threshold is changing very commonly now, and so I think the important thing is to speak to your family doctor. Based on things like family history, ethnicity. These sorts of things can guide a patient in deciding when the right age is to start screening.
Family history. Okay, so if it runs in the family, it's something that you want to be a little more concerned with.
I think so.
Okay.
Typically, first degree relatives. I think it's something that you really want to be aware of.
Does diet, lifestyle increase your risk at all?
Well, there are certain things that people are looking at. I don't think many things have been definitively proven, but it never hurts to lead a healthy lifestyle, and I think that definitely helps. But also, screening has definitely been one of the most important things in detecting prostate cancer early.
That's excellent advice right there. Well, if you're doing those bad things, stop anyway, right? Regardless, regardless of what impact it's having.
Right. That's how I feel
Excellent.
about it.
Yeah, very good. Dr. Saya, is there a website or a phone number where someone can reach out for more info on ProCure?
Absolutely. The easiest thing would probably be to go to the ProCure website. That's www.procure.com.
Excellent. Well, always good, Dr. Tsai, to have you on WCTC, and thank you so much for your time this morning. Some real good information, and great to have you on the show again, Doctor. Have an
My
excellent day.
pleasure.
All right.
Thank you. You too.
All right. Thank you.
Bye bye.
All right, Dr. Tsai, my guest here on